Hi, I'm Todd Coulson. I've been a home health nurse for 10 years now, and I just wanted to talk to you for a moment about something many home health agencies are starting to explore, and that is using AI to assist nurses with charting their narratives. It's not to replace nurses, but to help them document faster, more clearly, in a way that supports Medicare compliance. Because we all know one reality in home care, and that is documentation takes a huge part of our day. Sometimes we spend upwards to 15 to 20 minutes writing a single narrative note, and sometimes combined with many visits, this can take hours. But AI can help reduce that burden while still keeping the nurse fully in control of the chart. What AI actually does, I just wanted to clarify something important. AI does not perform the assessment and does not make clinical decisions. The nurse still performs the visit and records the clinical findings. AI just simply helps to organize those findings into structured narrative note. For example, a nurse might enter bullet points like CHF patient, crackles in lungs, weight up 2 pounds, medication confusion with Lasix, and education provided on fluid restriction. The AI then helps turn those notes into a clear, complete narrative documenting the skilled nursing care. The nurse reviews, edits, and signs off on the final document. So the nurse remains 100% responsible for the chart. AI is simply just assisting with the writing process. Now there's some concerns that have come up about this, and will this cause compliance problems? Well, this is probably the biggest concern that agencies have. The key thing to understand is that AI is not creating clinical care. It is helping the nurse structure documentation around the information they have already collected. In fact, AI can actually improve compliance by prompting for elements auditors expect to find, such as skilled nursing intervention, clinical assessment, patient response, and education provided, and the plan of care. Many narrative notes get denied because care wasn't necessarily wrong, but because documentation was incomplete. AI can help make sure those important elements are not missed. And the nurse still reviews and edits the note before signing off on it, just like any other documentation. Another objection that is often thought about is, what if the AI makes mistakes? Well, that's a valid question. The key is that AI is used as a drafting assistant, not an autopilot system. The nurse provides the clinical information, and AI helps organize it into readable narrative. But the nurse must review and approve the final note before it becomes part of the record. Think of it like this: using speech dictation or a grammar tool. It helps with writing, but the clinician still remains the responsible party for the accuracy. When used correctly, AI can actually reduce errors by helping structure documentation more consistently. And then another concern that people have is, what about HIPAA and patient privacy? Well, agencies should only use HIPAA compliant AI platforms designed for healthcare documentation. These systems typically include secure encryption, no storage or identifiable patient data, and protected processing environment. Many agencies also use workflows where identifiable information is minimized or removed before using the AI assistance. The goal is to treat AI tools the same way that we treat any other secure healthcare software system. The reality is that documentation is one of the largest sources of nurse burnout in home health. AI isn't about replacing nurses, it's about giving nurses time back so they can focus more on patient care instead of paperwork. When implemented properly, AI can help improve documentation clarity, reduce charting time, and support compliance, and reduce clinician burnout. And in home care, those benefits can make a real difference for both staff and patients. Well, I hope that this kind of clarifies things. And if you have any questions or comments, you can put them in the comment section. Thank you, and we'll see you on the next one.